issue that happened, so we need to appreciate UNIMED. Thank you very much. Permit me to read, so we need to appreciate UNIMED. Thank you very much. Permit me to read my structured speech. So the Vice Chancellor, distinguished members of the Senate, my esteemed family of our graduate, representation from the state government, ladies and gentlemen, it is with profound honor and gratitude I respectfully Nigeria. Your commitments, quality assurance, curriculum alignment, competent faculty staffing, functional clinical laboratory, and ICT enable the teaching and assessment reflect the university standard in producing our workforce. The board has recognized your compliance, and I extend my deep appreciation to the Vice Chancellors, the Senate, and the Department of Community Health for their exemplary. To our graduates, I said, congratulations, congratulations. You are standing here today, not by chance, but through diligence, discipline, academic excellence, and interprofessional public trust. A profession with direct bearing on population in terms of primary healthcare effectiveness, community well-being as essential workforce to redefine the health system in Nigeria on the following areas. 1, strengthening primary healthcare, PSC delivery. 2, advancing health promotion and disease prevention. 3, support surveillance of epidemic and prone disease reporting. 3, divine maternal and newborn child is a challenge in Nigeria. High cases of infant and maternal death. Provide community emergency response, contribute to what? Achieving universal. Community health practitioners are the backbone of healthcare delivery. Universal and hard-to-reach areas are instrumental in improving healthcare across the nation. You are trained to integrate clinical competency, public health intelligence, and community engagement, a blend that makes the profession unequally impactful, shaping our health outcomes across the nation. As you take your induction oath today, remember that ceremony confers upon you a legal practitioners under the Community Health Practitioner Registration Board of Nigeria Act. Your practice henceforth must strictly comply with the following: the National Standing Order, revised edition, hard copy, and mobile app utilization during your services at the primary healthcare level, core ethics and etiquette of professions, regulatory standard operating procedure, mandatory continual professional development, scope of practicing limitation. There are areas you need to refer is beyond your and the etiquette of our profession in terms of administering your services at area you find yourself in. Expected to uphold ethical discipline, professional decorum, confidentiality, respect for patient rights, accuracy in documentation, and zero tolerance of any form of malpractice in your service delivery area. As a professional, you need to take note on the following: serve with humanity and humility. Get this thing clear. Serve with what? Humanity and humility. Save lives. 3, uphold professional is dynamic. When I was like you, as a child, 1988 far back, I was trained to treat malaria with the almighty chloroquine. Now, are we using malaria in treating? Are you using chloroquine in treating malaria? No. Medicine is dynamic, is changing. In medicine, 1 + 1 cannot give you 2. It's only in arithmetic 1 + 1 can give you 2. What I'm trying to say, the sign and symptom of somebody having fever with you differ from sign and symptom for somebody that's having fever. You cannot say basically these are the things you need to get in all patients. So medicine is dynamic. Formerly, we don't know COVID-19. Now, for the last 2-3 days, COVID-19 come to Nigeria, and there are other public emergencies can come out. You are not trained. You have to have knowledge. I once again congratulate the university faculty, the parents, and all above the graduate. Today, you join the profession in honor of responsibility and lifelong services. May your practicing bring health, hope, healing for the community you shall serve. Strengthen your commitment and ensure diligence across the nation. Once more, I'm saying congratulations, keep to the standard and do it. So on this note, I want you to be on your feet. I want to invite the legal learned colleagues. That's the language you use. These are 35 graduating students of UNIMED who have studied through this and acquire Bachelor of Community Health Science, dated unto me as the registrar.
Hereby solemnly declare, swear and Bachelor of Community Health Sciences. I will, to the best of my ability, serve humanity, caring for the sick, promoting good health, and working with my fellow community health practitioners and other colleagues to meet the demands of my patients. I shall never intentionally do all harm of my patients. I will not permit considerations of gender, tribe, ethnicity, religion, political affiliation, or social standing to influence my duty of care. I will assist my patients to make informed decisions that coincide with their own values and beliefs, and I will uphold patient confidentiality. I will recognize the limits of my knowledge and seek to maintain and increase my understanding and skills throughout my professional life. I will acknowledge and try to remedy my own mistakes and honestly assess and respond to those of others. I will seek to promote the advancement of community health knowledge through teaching and research. I will be faithful and bear true allegiance to the Community Health Practitioners Registration Board and all regulations made by it at all times. I make this declaration solemnly, freely, and upon my honor. So help me God. So just append your signature to where you have the declarant's signature. And to the registrar and the vice chancellor, I present to you the newly inducted community health practitioners.
Thank you very much. Now you are fully registered members of community health practitioners in Nigeria. So congratulations. We cannot, because of the time factor, we are selecting 3 students formally to present 3 things to them. After we'll hand over the lesson to your head of department. Today, everybody will collect his certificate of registration, certificate, license, induction certificate. These are the 3 items. We come all to your item 35 of you. But we cannot, can we call out all of them? Okay, we call all of you. I will request the MC will call you, the representation of the VC. They come. Okay, VC, let's put our head together.
just come.
Take handshake.
Shake hand and go. I did get you first. We'll do that at the appropriate time, not now.
No, it was just
No.
Okay, why you had the apology?
Okay.
All right, thank you very much. We are sorry for that short break in transmission. We are trying to ensure that things go on smoothly. At this point, what we'll be doing is what we call symbolic representation or presentation of certificate and license to inductees. This is the order it will go. We are going to call 3 people amidst you who will receive physically the certificate, and others also will line up one after the other after that to shake hands, and then you come from there and you go this way. I'm going to tell you at the appropriate time. The person that I will be calling now is Adegeye Oluwafemi Victor. Shebi is taking this too. And the next person, quickly, please be on your feet. Ashemudara Grace Olayemi. Ademola Michael Omodolapo. I've called it. And please, could you please stand, others? Starting from the front, please line up and come down to the podium. From the front seat. Hurry up, from the front seat, thank you. Thank you very much, the registrar. Please let's put our hands together for the registrar and every other person that has assisted him in doing that. And our hands also, let's clap for the newly inducted. Distinguished ladies and gentlemen, at this point, we will be doing admission of the inductees into the profession. And to do that for us in the next 1 minute is the Vice President, Association of Primary Health. No? Ladies and gentlemen, please let's welcome Dr. Francis Balogun to formally admit the newly inducted.
We are now colleagues now. Let's clap for ourselves.
Please, a round of applause time. We are gradually getting to the end of the program. I believe in the next 10 minutes or thereabouts, we should be out of here. I want to call on Comrade Olabisi Adewumi to give the professional charge in 120 seconds.
Professor Adebayo, other principal officers, the CEO, the digital registrar of our time, who have now involved in the community here to be in the limelight among the rank and file of other professions. Thank you very much. The guest speaker, Professor Gibanson, CEO, Dr. Ibrahim. Community health has come to stay among the rank and file of other professions. Please take it as a point of reason. You are not appendage of any other profession. You stand up, you stand on your own. And please, what is worth doing at all is worth doing. You should join it too, because life itself is not dynamic, it's very dynamic, changing every now and then. And what is worth doing at all is what? Worth doing well. The sky is the beginning for you. Thank you. Thank you very much.
Please let's put our hands together for him. I'm sure some of you were trying to get what we were discussing. I gave him 120 seconds and 120 seconds on the... And I told him that if I were a woman, I would just ask him to marry me. Because he will manage me well, for him to have been able to manage time very well. Thank you very much. Distinguished ladies and gentlemen, this is one of the moments we've all been waiting for. These ones have, and it is time to celebrate them. Registrar, to please stand, because we have something. Nigerian University Community Health. Hold on. Alabi Samson will be presenting an award to the registrar for what?
Sir.
And it's evident from the way you've been shouting each time his name is mentioned. Carry your this thing. May I ask the HOD of the department, Dr. D.O. Ibrahim, to stand. All right. Now, this is the biggest moment of today. The moment we've all been waiting for. The moment when excellence, graduating student, okay, is student, okay, is the same name also now. I don't know, something must be about that name. Maybe that is the way of Ondo State. You know, we have a special governor also in this state that his name has been working for, okay? Wherever he has been working for, okay? Wherever he is, indeed, Ayeti Dati Bubuwa, and then you realize that Ori Mison, you know, whatever name they call you, always check. Before I answer to my surname, I traveled to my hometown to find out the history behind that name. That tell me what it means. If I don't know what it means, if I don't like it, I throw it away. Then I use my own name. But when they expire proudly, when I mention it, for some of you that may want to know the meaning, you may come and see me. I will tell you what it means. There's also something about this particular name. He is the biggest masquerade for this event. He has worked tirelessly, and it is the moment that we need to celebrate this young man who has come out victorious, and his name also is Victor, and he is the overall best graduating student. Ladies and gentlemen, let's give it up to Adegeye Olufemi Victor. And to present the award, he is the registrar.
Okay, this is an award of excellence to the best graduating student for Bachelor of Community Health Science. Congratulations. Congratulations. And being the best student, I need also to give him an award. I didn't prefer my award, but I'm attaching cash of 100,000 to him. Yes.
Thank you, sir. Thank you, sir.
He didn't show the money. And I must also say this, the registrar. Only, I'm jealous. Maybe I will change my name to Victor. But don't worry, I love my name as it is. It's a special name. Distinguished ladies and gentlemen, it is time for us to take the final bow by the inductees. And to do that for us is Dr. Oladejo. Please, a round of applause for Dr. Oladejo.
The physicist, sir, permit me to stand on the existing protocol. Can all the inductees stand up and remain standing? You want to take a final bow now, and you have that responsibility to three groups here seated and on my right hand side, and so it means you are going to, you face them first, then you face one. So at the count, so 1, 2. Turn to your right. 1, 1, 2, 2. The second bow is to the parents. Bow. Now to your right. At the count 2. Then your final bow now. Team management. Without the university management, honestly, what we are doing today, we are celebrating today, it wouldn't have been possible. And so we appreciate our dear Fisi, ably represented by the Dean of the Dean, Professor Adebayo, and other members of the cabinet, we are saying we are very grateful. We appreciate you, sir, for understanding us when it is right and when it seems it is not right for us to react. You accepted us as we are, and it is your tolerance that made. We are saying thank you, sir. At the count of 2, you take your bow. 1, 2.
Please let's put our hands together for Dr. Oladejo. And very quickly, before we wrap up today's induction ceremony, I want to call on the representative of the inductees, Ms. Ashemudara. A 120-second response.
Many of us have imagined for so long. Some days we imagine, many of us have imagined for so long. Some days we imagined it clearly. Other days we weren't sure it clearly. Other days we weren't sure we'd ever reach it. Yet here we are, not just present, but present with strength, growth, and me right now moments. When stress was hanging on our shoulders like a heavy jacket, me right now moments. When stress was hanging on our shoulders like a heavy jacket. But through every moment, means so much. During this journey, we also remember someone dear to us, Teniola, who began this path with us, but is no longer here to witness this moment. Her dedication, her laughter, her spirit, and the way she carried herself remains a part of our story. Today, we honor our memory with love. Our absence is felt. Today, we honor our memory with love. Our absence is felt, but our impact lives on in the hearts of everyone who knew her. May this achievement also stand as a tribute to her strength and to the dreams she carried. With patience, discipline, and guidance. To our parents, guardians, and loved ones, your constant belief is the major reason we are celebrating today. Thank you for standing, inductees. Look around you. Every face here carries a story of sacrifice, of endurance, late nights, early mornings, anxiety, determination, and growth. What needs professional with hearts? Competent professional, yes, but also professionals that are compassionate, intentional, and grounded in integrity. And that's who we are becoming. So as we transition from students to inductees, from learners to practitioners, let us walk boldly, not because we have every answers, but because we are ready to learn, ready to grow, and ready to serve with excellence. Congratulations to every inductee here today. May this be the beginning of a journey we will look back on with gratitude, pride, and joy. Thank you. Pride and joy. Thank you.
We can do much better than that. Distinguished ladies and gentlemen, on behalf of the Vice Chancellor of this university, Professor Ebunlua Aderonke Adejuyigbe, we want to sincerely appreciate the regulatory body for taking their time to be here. Every member of the board ably represented here today, our guests that have come all the way from far and near, the parents, the academic staff, the inductees themselves. This is an induction ceremony I will not forget themselves. This is an induction ceremony I will not forget in a while. Ask me why. The comportment, the composure, the way you have behaved, the cooperation has been top-notch. And indeed, we are very grateful to you. And lending some words from the representative of the class. She said, this is a proof that they showed up when it mattered most. And indeed, it's a proof that they showed up. And we thank everybody here again that have shown up today to celebrate these ones. We are indeed very grateful to all. And like the representative of the Vice Chancellor said at the beginning, we have so many programs that we run in this university. Our parents that are here, you have become our ambassadors. You have become our friends. Go out there, stay on the mountain, tell people that you have come to the best university in and around Africa here when it comes to medical science education. We are there for you at all times. Go out there and spread the gospel. Ladies and gentlemen, my name is Isaac Oluyi. I'm the university PRO, and we thank you most sincerely today. On that note, may I please crave our indulgence to stand as we bring this program to a close by taking the UNIMED anthem. The procession in reverse order. Please let's remain standing as the procession goes out.